You're watching Good Morning Nigeria, reaching you live on the network service of the Nigerian Television Authority. Now, for our first topic, which is on matters arising with regard to the containment and mitigation of COVID-19 in Nigeria, we have joining us in the studios this morning, the Honorable Minister of Information and Culture, Alhaji Lai Mohammed. Honorable Minister, pleasure to have you again on the program.
Good morning, thank you.
Of course, Alhaji Lai Mohammed is a member of the Presidential Task Force on COVID-19.
Honorable Minister, you're welcome.
As always.
One of the critical aspects of containing COVID-19 globally, is contact tracing. And can you enlighten Nigerians on how we are going about that, the progress being made with respect to contact tracing and tracking, as it were?
Right. Actually, the strategy of the COVID-19 task force is to trace, test, isolate, and treat, in that order. And when we say trace, we're tracing people who've either come from countries where there have been very high prevalence of COVID-19, or those who have come into contact with them. We've had a lot of success in those who have come from countries with high prevalence of COVID-19. To date, we've traced almost 8,000 of them. We say with about 8,932. But as of today, we have only 220 that we are still monitoring. See, what we did was that we've been contacting those 8,930 daily and monitoring, their health status. Because the trick is that if you have not developed any symptom within 14 days of when you came back, or when you had contact with somebody who had it, then we'll let you go after 14 days. So as of today, as of 2 days ago, we had only 220. And these are people that we call daily, we monitor, we ask them, what the symptoms are, how they are feeling. So it's only about 220 of them that are still, we call them persons of interest, that we're still monitoring. However, the other areas of tracing are those who have come into contact with these people who have traveled, not necessarily people who have tested positive. Because the unique thing about this virus is that a person may have no symptoms at all and may still be a carrier and might still transmit. Now, and these are the people that we are finding much more difficult to trace, because it takes a lot of some voluntarism on their part to come out and be tested. So, by and large, we're working with technology, we're working with all other agencies, and I think that we are making some headway.
Well, the point has always been made, including by your good self on Good Morning Nigeria and at other fora, that coronavirus is an imported disease for us. And one of the most prolific sources of importation was through the airports. And now our airspace has been closed in and out traffic, except for otherwise essential. But in recent days, we have started to see movement of land transportation, persons who are coming in through our regular land borders. In this case, Lagos is, as it were, again, bearing the brunt of these persons who are coming in. We saw the example in Osun, where Nigerians returned from Côte d'Ivoire, and you saw the number of persons who tested positive, including one or two who escaped into the population at Ejibo. Yesterday on Good Morning Nigeria, we raised the issue with one of the two governors, who were with us, the governor of Kebbi State. Kebbi, as part of Nigeria, has borders with Niger and Benin Republic. So, how does this now become a point of interest to your task force that, yes, airports have been closed, and then suddenly we are seeing people who are coming in through land borders? And yesterday I was listening to the Lagos State Commissioner for Health, and he said that some of the latest arrivals, a number of them tested positive. So how does that affect, your projections and even the work that you are doing?
You see, Kingsley, under international laws, under our constitution also, you can't refuse a Nigerian to come back to his country. And that is the challenge we have. We have Nigerians who are coming from Togo, who are coming from Benin Republic, who are coming from, the West Coast. And we must necessarily allow them to come in. But what we've done is they will come in, but they'll be quarantined. And I think both Ogun State and Lagos State in particular that I know have actually acquired, hotels in the 2 entry points. So as soon as they come into contact with our health officials, they are isolated, immediately. They are put in separate rooms and they stay there for the mandatory 14 days, during which they are monitored. And after the 14 days, whichever of them have symptoms, will have to undergo a test and then will have to go for further isolation. We were in Lagos on Tuesday and we were quite impressed with the level of preparedness of Lagos State in particular, because as we speak, Lagos State has about 10 hotels all over the 3 territorial district of the state, where, not just, people coming from the land border will come in and it will be isolated, but in the unlikely event that there's a surge and we need, more bed spaces. But as of the time we went to Lagos on Tuesday, Lagos State has over 1,000 or about 2,000 bed spaces that it can really, take in the event of a surge. So yes, it's a problem, but we have to, we have to contain it. And here is where we need, especially the support of the state governors, also, especially those who have borders with neighboring countries like cross rivers, like I'm not sure, like Niger, like Kebbi, like Sokoto, I believe too, and then I think of course Ogun, Lagos, obviously. But they need to be proactive. They don't need to wait for the surge to come. They must prepare and work with the various health authorities, especially the port health, immigrations, and others at our land borders.
Might it be clear, and I was going to write on this, might it be advisable so that current facilities being provided mostly by, say, Lagos State government to receive those who are coming in via the land borders, and I think they were also setting up an isolation center in Badagry. Might it be advisable to say, look, yes, there are Nigerians who are returning, but so that those facilities are not overwhelmed, that, look, we cannot process more than so many number of persons, either on a daily or on a weekly basis, whenever they come in through the land borders officially.
Well, then, Kingsley, there will be a problem. Why do you keep them when they come? You see, Nigeria is coming from Ivory Coast. And he says, I have the right to enter Nigeria, whether I'm dead, I'm sick, or this is my country. So all we can do is that we monitor the flow and we increase our capacity, we increase our facilities, because it's not just about space. It's also about personnel.
That's true.
At the same time, it's also about surveillance at the same time. So it's quite a huge challenge, but we are trying our best to contain it. And we must say that both Ogun State and Lagos State in particular, that we've been that we get regular report from, because they have this highest incidence of people coming from outside Nigeria, and our other state governors are also doing their own bit, but we need to depend on them.
Yes, I was going to actually ask whether there's a mechanism by which Nigerians that are coming from other parts of Africa who likely use the land border, whether they are adequately monitored to know who comes in when, and of course whether they should be quarantined or not. But that's part of the question I'd like you to answer. If there's any kind of a collaboration, between the task force, the state governments who are governing, states with borders, with the neighboring countries. Another aspect of this is the projections. Now, the federal government has been commended variously, for its effort in combating this coronavirus, right from even before the index case. And of WHO, the UN have also said that we have been making a remarkable progress. But what obtains elsewhere with respect to where we are going with this virus is the fact that they're making projections to say, look, within so time, we expect so number of deaths, so number of survivors. But in our own case, we've not gotten to that point. But what I want to ask is there any kind of projection, or how much time does Nigeria have, before the disease becomes unmanageable? We are not praying for that. But the trajectory of the disease elsewhere, especially when you have a population like we do, of course, it should be expected. Is there any projections of such that helps you to plan ahead as you move on with the fight?
Currently, we have a very little window. You see, I keep emphasizing that as of today, there is no known cure, no known vaccine for this disease. Therefore, all we have is what we call non-pharmaceutical intervention, which is a protocol of what you need to do to prevent it. Since it has no cure, you can only prevent, manage, and contain. And for prevention, you need the cooperation of the populace. They need to listen to what the government is saying, especially through their various agencies like the Port Health, the Center for Disease Control, the Ministry of Health. You see, the whole point of a lockdown is that when you lock down within 14 days, there's a presumption that whoever is incubating the virus must manifest within 14 days. If it does not manifest within 14 days, then you are clean. Except if you move again and get contaminated by not staying at home, by not maintaining social distance, by not washing your hands, frequently. But what do we have today? People are asked to stay at home, and they are not obeying these regulations. They are still congregating. I hear some religious leaders saying that no Jupiter can prevent them from either conducting their Jumat service or their Easter service. And we begin to wonder, are they true Christians? Are they true Muslims? If they are true Christians, where do they take their compass from? From the Pope or from the Queen? The Queen today we know is the head of the Anglican Church, and we know her position on the coronavirus. The Pope is the head of the Catholic Church. We know his position on the issue of COVID-19. And yet some people are pretending to be more Catholic than the Pope himself, and to be more Muslim than even the Prophet Muhammad himself. If Saudi Arabia can stop Umrah, which annually probably attracts about 7 million religious tourists and adherents, and they can say, look, you don't have to come for the Juma congregation service, they limit the number, and the Pope himself is ready to give his homily through television, online, then what is our problem? You see, so we have only this little window, because that's why I'm coming to the figure you are talking about. It's real. The modeling is real. If you have a population of 200 million, it's real, because what they tell us, this thing is a disease of the elites. After all, I've not traveled abroad. I've not met somebody who has traveled abroad. But Nigeria is now, especially after we close our borders, we are transiting into the most dangerous phase of the disease, which is community transmission. All it needs is for one person to infect 10 people, which is very easy because we are very mobile. Each of those 10 will also infect 10. Those 10, and by the end of the day, from one person, you have 1,000. This is real. Now, where are the facilities? The most developed healthcare systems in the world are collapsing. Italy, Spain today, they say that the cemeteries are coming under severe pressure because they have to bury so many people. Now, what's going to happen to Nigeria if all of a sudden we have 5,000 cases?
That would be a disaster. Yeah.
That is where, and honestly, it's the easiest disease to prevent.
But what are we doing to stop the religious leaders who have insisted on congregation at this point in time? What are we doing to them?
Religion is a very sensitive issue, but we are engaging them. 2 days ago, the chairman of the task force, Boss Mustafa, actually met with the Catholic Bishop of Abuja and was pleasantly surprised at the level of cooperation he received from him. He led a team of bishops and they offered us 60 properties of their own all over Nigeria, if need be. And they assured us that as far as they are concerned, that this is not about religion, it's not about politics, it's about humanity, it's about survival. And we thank Bishop Kagama. I think it's
Archbishop.
We thank him. Those are the kind of leaders we want.
What about leaders of other churches that are
Pentecostals? You see, I think my take is on both sides of the divide. Some people are not leading their faithfuls aright. And it's on both sides of the divide, I must say. In Katsina State, in Kusada, you remember that a mob went and balled down the police station simply because they refused them. They prevented them
from going to pray, human prayer.
And like I say, the hadith is very clear that in a time of pandemic like this, you stay at home. You listen to the authorities.
So I was just wondering, Honorable Minister, that's because this is also related to it. Yes, we see what the Presidential Task Force is doing. Yes, we also see what some state governments are doing. When are we going to have a harmonization of the efforts of most of the state governments and the Presidential Task Force, which is at the federal level, and then you avoid the kind of spat that we have seen, for instance, over whether or not the choppers can fly into River State and elsewhere, and over whether or not there should be a continuing lockdown in the particular area. Because if the whole idea is to say, look, prevent person-to-person transmission and have a lockdown so you can manage your population. Others say, no, there's no lockdown. We are only closing our entry and exit points. When are we going to see this harmonization?
Kingsley, there is need for further and continuous engagement with all our subnationals, because the kind of rift we have today is absolutely uncalled for, is unnecessary. This is not the time for politics. Now, the federal government has a responsibility for all Nigerians. Now, a situation whereby the federal government would make exemptions for certain people, category of people, and then the state government would not cooperate, is not helpful. Take the instance of the land borders. Of course, we close all borders. But we are admitting Nigerians who are coming home. These Nigerians are from every part of the world, and they come from every part of Nigeria. But I know that the Secretary to Government, he also doubles as the chairman of the task force, is working to have a seamless relationship with the state governments. But I agree with you, we will not succeed if there's no cooperation with the state governments.
Honorable Minister, we're actually running out of time. Before you go, just clear the air on the issue of Chinese doctors in Nigeria. A lot of things have been flying all over the place concerning them. We've heard on the government part that the Chinese are not going to, work on the front line. They'll not be the people administering treatment on our patients, but they have other logistical or, if you like, technical supports that they have come with. Just clear the air on that.
You see, number one, we did not invite the Chinese. The Chinese, especially the CCC, out of their own belief, their own corporate social responsibility, decided that, look, Nigeria has done so much for them. But they'll be operating just in 1981. And that when this pandemic started, Nigeria behaved so responsibly, that they believe that they owe Nigeria something back. So on their own, decided to bring in about 256 items of equipment, of commodities, to help us contain the virus, including 50 ventilators, test kits, and others. Two, of course, they could not just send this equipment without those who would go and
install them,
oversee them. Thirdly, they believe that these doctors can exchange their experience, share their experiences with our own health authorities on how they managed their own pandemic. But more importantly, and this one Nigerians must understand, that even today, if you have the resources, you have the funds, those equipments are not available. South Korea has banned the exportation of anything that has to do with containment of COVID-19, whether it's masks, whether they are ventilators, whether they are test kits. The U.S., as powerful as the U.S. is receiving consignment from Jack Ma, receives consignment from another couple. And I listened to the New York governor expressing gratitude. And you see, thirdly, there's a proverb that says that when somebody offers you a medicine as a cure for the ailment, you ask him 3 questions. Have you ever suffered that ailment before? When you did you use this drug? When did it work? And this is exactly what we see in the case of the Chinese. But they are not coming to treat Nigerian patients.
Yeah,
they are coming to help us even build our own capacity to contain this.
That's right. Yes. On that note, we'd like to thank the Honorable Minister of Information and Culture, Alhaji Lai Mohammed, who is also a member of the Presidential Task Force on COVID-19. Hopefully, we're going to have you from time to time, to provide updates as well as explain other perspectives. But we do know that there are some states of interest that we have to watch. Yes, the 14-day lockdown is coming to a close. Some people are saying, the thing is going to be over. It depends on the expert advice that the president receives. Alhaji Lai Mohammed, thanks a lot for being with us.
Thank you very much.
Okay, it's Good Morning Nigeria, live on the network service of the Nigerian Television Authority. We'll take a short break now. When we return, we're still on COVID-19. This time, we're dealing with healthcare workers who are on the front line. All right, now as a prompt for our next topic, which is still on COVID-19, healthcare workers on the front line, let's take this backgrounder from our correspondent, Abdusalam Jibril.
At a time when the world is facing a health crisis, health workers fighting the coronavirus pandemic, like doctors, nurses and midwives, laboratory scientists, amongst other healthcare professionals, are the frontline soldiers in the war against coronavirus. The important role healthcare workers play all over the world, especially when there is a pandemic like the coronavirus, with cases still increasing in some countries, was re-emphasized by the World Health Organization with the celebration of the World Health Day, which focused on support for nurses and midwives, drew attention towards healthcare workers in the front line of COVID-19. Since health workers are the front line of any outbreak, they are exposed to hazards that put them at risk during any epidemic or pandemic. 6 years ago, during the Ebola outbreak, the World Health Organization estimated that more than 350 healthcare workers died while battling the disease. In the current battle against COVID-19, the World Health Body also states that there is a shortage of personal protective equipment (PPE) endangering health workers worldwide. Recent WHO statistics estimates that over 5,000 health workers, which include doctors, nurses, and laboratory scientists, have been infected by the COVID-19 since the outbreak began in December 2019. In Nigeria, as confirmed cases of the virus continues to rise, health workers are exposed to the virus due to many factors like patients' decision to hide travel history and health workers' negligence. For instance, at least 12 health workers at the Lagos University Teaching Hospital, LUTH, were placed under compulsory isolation after they came in contact with a confirmed case of COVID-19. Now, the question is, what efforts are being made to ensure that health workers are adequately protected against COVID-19? Negligence by health workers has also been identified as a major factor. How can this be effectively tackled towards ensuring that they take precaution when attending to suspected COVID-19 cases? And what is being done to ensure that health workers have enough personal protective equipment? Guests on Good Morning Nigeria will be providing answers to these and more shortly.
And to discuss COVID-19 health workers on the front line, I would like to introduce first Dr. Dandel Dafra. He's a pioneer chief medical director, University of Abuja, Teaching Hospital, Gwagwalada. He's also a retired consultant, special grade 1, Federal Minister of Health, and the medical director, Rich Care Multi Services Limited. It's good to have you this morning, sir, on the show.
Thank you very much.
All right, and we also have here in the studio Dr. Isaac Abuja, a public health consultant. You're welcome to the program.
You're welcome. Good morning.
Also with us in the Abuja studio is Dr. Chris Otabo, consultant and orthopedic surgeon, Alliance Hospital. It's good to have you again today.
Thank you for having me.
All right, so those are the three doctors we have with us in the studios, but we have three other guests who are joining us via Skype. From Abuja, via Skype, would like to welcome Dr. Francis Fadile, who is president of the Nigerian Medical Association, NMA. Dr. Fadile, pleasure to have you again on Good Morning Nigeria.
Thanks very much. It's my pleasure to be here with you.
All right, we're hearing some barking sound. We hope you don't have any dog around you there. Then we also have joining us for this conversation, Shetima Ahmed Thomas, who is the Secretary General of the National Association of Nigerian Nurses and Midwives. Shetima, pleasure to have you with us on Good Morning Nigeria.
Good morning.
Okay, and last but certainly not the least, Dr. Vivian Kwage, who is head infectious disease unit of the University of Abuja Teaching Hospital in Gwagwalada. Dr. Kwage, pleasure to have you with us on the program.
All right, lady and gentlemen, you're welcome to the program. We are looking at the fight against COVID-19 and, of course, the people on the front line. As a history student, I could recall that between 1918 and 1920, the world witnessed Spanish flu. that affected over 500 million people globally, and about 50 million died across the world. And the majority of those that died were the medical personnel, who were confronted with a very strange flu as at that time. And today, we are seeing another strange flu, COVID-19. And of course, the people that are making things happen in this medical war are those on the front line. So I'd like to start this discussion with Shetim Ahmed Thomas, Secretary General, National Association of Nigerian Nurses and Midwives. What is your assessment of what is going on with respect to provision of personal protective gear and other facilities required to fight this virus in Nigeria?
Personal protective gear and other facilities required to fight this virus in Nigeria.
Well, thank you so much, Cecile. I think the challenges and the progress we have made so far is highly commendable. Particularly what the government have done in setting up centers, testing centers. I think it is a good idea. However, when you have the centers, we need personnel to work in the centers, and these personnel are pricks of being exposed to the COVID-19 itself. And therefore we need to first train these personnel. When we train the personnel, we need to provide the equipments, especially the PPE for everyone, because they are coming from the family. And we will not want a situation where they go back and infect the family. So we have to take care of them and ensure that they are not infected before they even start the work. And after that, provision of the materials. After provision of the materials, we also know that there is the need to cushion the effects as we are talking globally. Therefore, the health personnel need to be catered for by the federal ministry or by the government to ensure that every health worker is taken care of, especially the professionals that are on the line, like the nurses. The nurses stay with these patients for 24 hours. And therefore, the chances of getting infected is very high. If you remain with somebody for 24 hours, you are sure that if appropriate measures are put in place, the patient yourself, and that is what we are trying to avoid. We do advise government that anywhere, the best they should start with is to train the personnel on how to handle the situation. I have no doubt they are professionals, they are aware of the thing, but the application of the PPE and the rest of the technicalities involved is highly interesting.
All right. Thank you very much, Shetima, for your opening statement. Let's join Dr. Vivian Kwage, who is head of the Infectious Disease Unit at the University of Abuja Teaching Hospital, Gwagwalada. And we all know that Abuja, which is Nigeria's federal capital territory, ranks second behind Lagos in terms of the reported number of infections. Give us a view from the front line as a healthcare worker in these very challenging times where the whole world is struggling to understand this COVID-19.
Good morning all, and thank you for having me on the program. My name is Dr. Vivian Kwage. I work in the University of Abuja. Gwagwalada, I hope you're hearing me. So for me as a medical doctor, an infectious disease physician,
yes, somebody else. You know, this thing helped.
It's an honor.
All right, it looks like there's some interference. I'm sure our engineers are going to have to instruct Dr. Vivian on what she needs to do in terms of the ambience, the environment from which she's speaking to us. We have a lot of interference coming from other sources. We try to usually get done in the first part of our conversation with the Skype connection, because sometimes it can be problematic. But let's get now to the studios and bring in Dr. Chris Otabo, who is of Alliance Hospital. We've had you in the studios here in the past. We've also had Dr. Abuja, with regard to discussing various dimensions of COVID-19. But today our focus is on healthcare workers who are on the front line. What is it that you're getting to hear from your colleagues, and that you yourself you are also seeing with regard to the containment, if not abatement, of COVID-19?
Thank you very much for having me. I'll start by really appreciating the leadership of the country, starting from Mr. President to the last man in the field, for doing a very good job in terms of response to the pandemic in Nigeria. And so much effort is being put in and results are coming in. But still talking on that, I would think that there's a missing link somewhere. I think as a doctor, the national president of the Nigerian Medical Association ought to have featured in the presidential committee on COVID-19. Why did I say so? That's where the problem, I heard you ask the Honorable Minister for Information about the Chinese doctors issue. The reason why this problem is because of communication gap. There's a mismanagement of information. If the enemy president was in that committee, I believe that he would have had all the perspective, and he and the Minister of Health would have come out to address a joint press conference. That would have put paid, because it's having a negative effect on the fight. Because someone that is leading over 30,000 doctors in the battle, I don't understand why he should not feature at the highest level. Coming back to the medical workers who are in the front line, we are all exposed. Yesterday, the 100th doctor died in Italy. 100 doctors. You know what it takes to train one doctor, and 100 of them have been slaughtered in these last few months because of exposure, because of risk. So every doctor who is practicing in Nigeria is at risk. And that's why we're talking about protection, personal protective equipment. See, the people that would end up in the isolation centers, they don't go there as a point of first call. They go to the regular hospitals, they go to the general hospitals, they go to the private hospitals. And unsuspecting healthcare workers would already be exposed before they are identified. Remember the story of Dr. Stella, who lost her life in the Ebola crisis. It's not far from it now. So the people who have the highest risk of exposure are the healthcare workers. And so we must pay attention to the needs of the healthcare workers, and training and retraining, and then create incentives for the healthcare workers so that they will be able to muster all the energy to be able to push this virus out of the country. I think that will be my opening statement.
All right, thank you. The sky is through now. Let's return to Dr. Vivian Kwahe, because in the question put to her by Kinsley, she was unable to answer that question because of the hitches we had a short while ago. So, Dr. Vivian, along the same line of the question, let us know how you feel about those on the front line. You being one of them, let us know what is taking place at that front line where, of course, you are facing an invincible enemy.
Okay, good morning, and thank you for having me on NTA. For me, as an infectious disease physician, it's an honor for me actually to be called to serve the nation at a time like this. I understand the challenges involved. I understand the risk involved, that I'm like a soldier going on the battlefront. But then, this is what I was trained to do, and this is what I have accepted to do. So, despite the risk, I know it is something that I have to do. So, for me, I don't think I would have done otherwise, face to face with what we are actually having today in the country. But given the necessary protective gear that I need to protect myself, I think it is okay for me to go out there and face the virus.
I would like to stay with you, Dr. Vivian Kware. Now, you are head of the infectious disease unit. What is the story from your other colleagues with whom you work in that unit?
Okay, when this COVID-19 came on, we, the senior doctors, actually decided to be in the front line. We didn't want to expose the younger ones. Of course, the younger ones, they're afraid, given the infectivity of the virus. We know that it is a virus that is highly infective, and going out there to be in the front line is putting your life in danger. So the senior ones, we decided to volunteer to be the ones to go out there to manage these patients. And, the junior ones, of course, we sort of like shielded them, and we didn't allow them to put their life at risk. So, yes, the fear is there. Everybody is afraid, but then someone needs to do the job. Someone has to do the job. You understand? So that is how it has been. We have colleagues who cannot even come close to the isolation center. They can't even come close to the isolation center. We have colleagues who are even afraid to even wave at us. Even to wave, they are afraid to even wave at us, because of fear of, getting in contact with this virus. But then, this is what we have been trained to do, and we cannot shy away now that the responsibility has actually fallen on our lap. We have to take.
Okay, there it goes again. There it goes again. But I like the spirit, with which you are doing this. And of course, what I've just said could also encourage other of your colleagues, who are so scared about carrying out their responsibility. Okay, let's come back to Abuja here, and of course, ask Dr. Chris Otabo once again. No, let's ask one from Dr. Nando Duffer, the Pioneer Chief Medical Director, University of Abuja Teaching Hospital. Now, you know the history, the trajectory of this disease, in respect to those on the front line. I'm just wondering that how come Italy as a nation that may have more protective gear that we have here at the moment could lose 100 doctors and other nurses since they have this gear? So what is strange about this virus, that will also, in some cases, affect those who really have the protective gear? Because from all indications, if Italy lost 100 doctors, it means that the protective gear may as well fail.
Thank you very much for having me in this program. The 100, I will start by saying that I do appreciate a lot what the federal government is doing in trying to combat the COVID-19 illness. But the case of 100 Italian, well, the infection could be outside the hospital before they come in because of the lifestyle and other things. But definitely you have a high number of people, like the case we have somewhere in Katsina. He's a doctor went to Kogi, went to Lagos, came to Katsina. It could be that he was exposed in one form, but it could be a source of exposure is different from the normal services. Maybe a social work somewhere, but not on the job. So the Italian one, some of them could be in that form. The personal protective equipment for a physician, you know that many of them are exposed in the normal hospital when they are attending to patients normally. Like we had cases of physicians and nurses getting infected, not because they are treating patients in the ICU or identified patient, but there are some that may present in the hospital without the identification of the illness. And in so doing, many of them get infected. We're in the hospital, in the ICU, you have this protective PPE. But in other places like the hospital, where you have your normal hospital or any clinic, you have your normal services by nurses, health workers, doctors, and other people. You need other dresses, form of protection, that when you wear it, it gives you protection against all microbes. This thing. It is a vest, it's a dress, not so bogus like the PPE, which is very good for protecting health workers in ICU. The Vestex is a normal wear. You can have it as a shirt, you can have it as a singlet, but it gives, and then you can have the face mask. It gives health worker, has already been tested, a protection of 99.9% against all infection. That one can be used for normal hospital workers to give them confidence, to give them the confidence to attend to all cases of high blood pressure, raised temperature. Anybody that comes in with malaria or early sign of coronavirus infection, you will have the confidence to attend to the patients. And indeed, we must try and visit that the clothing of all health workers with this preventive protective vestiging.
Okay, thank you very much, Dr. Doffa. Let's bring in now Dr. Abuja. Well, I recall some weeks ago, in the early stages, while we're trying to explore the outlines of COVID-19 and what the response would be, some of our habits as a people were highlighted. You were on this program and Dr. Tabo was also here. And we are beginning to see some of those things manifest now. 3 examples to cite very easily. LUTH, that's Lagos University Teaching Hospital. A gentleman, who, of course, had symptoms of COVID-19, was taken there by his relatives, no disclosure of his history, and then suddenly matters got complicated. He died, and then some of the doctors went into self-isolation. We have also seen what has happened at the University of Benin Teaching Hospital. 3 patients, who presented, no disclosure of their travel history. Tests were done, negative at first, then suddenly positive. One of them died. 25 medical doctors are on self-isolation. We have also seen at the University of Ilorin Teaching Hospital what has happened, where with regard to the exposure of medical personnel to a gentleman, who obviously had, COVID-19. He died and he was buried in Offa is on lockdown. These are the examples that, ordinary folks, would see. But for the medical personnel, what does this tell you, and how does it predispose you again to rendering your services in terms of either the heightened risks or the precautions, or in general, just the mentality to adopt?
Thank you very much. First, let me thank all health workers, be they nurses, doctors, pharmacists, medical laboratory technicians, scientists, cleaners in the hospital, whoever they are. Let me thank them for putting their lives at risk. Having said that, one of the things that we discussed and which you have highlighted is the fact that the responsibility of protection of health workers does not only lie on the authorities of the hospitals or of the government providing protective equipment or training for them. It also lies on the population, on the family members, on the patients that are coming in for treatment. And this is a case that we need to look at very critically. The doctor, the nurse, the laboratory technician, the pharmacist, whoever they are working in the hospital come from a family. And members of their family are at risk, not only them. And it behoves on us as a people, first to be honest with ourselves and to be also caring and be concerned about the lives of other people that we interact with or that we deal with, be it in business or in the hospital. Now, if you go to the hospital and you know you are sick, your problem is known to you as an individual. Why would you want to go to a hospital and not disclose it to the nurse who first receives you, not disclose it to the doctor who sees you after the nurse, and so on and so forth? What is your motive? Are you going there to kill them? Are you going there to get healed? Are you going there to test their knowledge or their skills? What is the motive, one would ask? If your motive is to be cured or to be healed or to be helped, then of course you have to help the person who is going to help you by one, providing accurate information about yourself, your age, your status. If they ask you, are you allergic to anything? And you say, no, I'm not allergic to anything. If I eat, I can eat everything. But you know that some time ago when you ate fish, you got sick. And when you ate fish again, you got sick. So in your family, they already know that you are allergic to fish. Well, so if they ask you in the hospital, are you allergic to anything? And you say, no, I'm not allergic to anything. What now you are putting your own life at risk. Because if they admit you and they serve you a meal with fish, it is not their fault, it is your fault. Now, let me come back again to the fact that for somebody to work well, efficiently and effectively in a hospital, he or she has to be emotionally stable, psychologically balanced, and of course, physically fit. For all this to happen, the person needs support from everybody, both from the authorities that are providing this equipment and training for the health worker, and for those who are going for treatment and family members.
All right, thank you indeed. This time around, let's go to Dr. Francis Adebayo Fadule, the President, Nigerian Medical Association, NMA. So we're glad to have you back via Skype. Want to get your assessment, first of all, of efforts being made to ensure that the health workers who are going to be on the front line, or who are already on the front line in this fight against coronavirus, how they are being protected. And again, there's a question that Kingsley posed which had to do with the behavior of some professionals in the medical field. Of course, he cited some examples, one of which is the case of Kwara, where a particular professor of medicine had to invite someone who already is positive without information to his colleagues. And now today, about 25 of them are quarantined. We don't know whether that's over yet. So all in all, what's your take on the preparedness of Nigeria in case there is a surge?
Well, thank you very much. It's very difficult for me to hear the audio very well. It's very difficult.
Okay, use an earpiece. If you have an earpiece there with you, you can use it so that you can hear me or hear us clearly here. You have an earpiece there with you?
I can hear you now.
You can hear me now. All right. Let me rephrase this all over again. We're talking about the health workers who are on the front line of this fight, and of course exposed to a very big risk. We're also talking about the personal protective gear or equipment, as the case may be, that is being provided for Nigerian health workers. We want you to make your own assessment, and going forward, what should we do with respect to protecting those who are doing this fight? Because of course we're going to give them whatever we have in our arsenal for them to be able to execute the war.
Well, thank you very much. I think we have to be appreciative of the effort so far by the government and people of Nigeria. But importantly, at the isolation centers, we want to also say that we have had some fair distribution of these personal protective devices. But importantly, is the weakest link in the chain of treatment of patients who are of our patients generally. COVID-19 positive patients are not likely to go straight to the isolation centers where they will be treated and be taken into the ward immediately. Most of the time, they will go to our regular hospitals where they will most likely have to meet doctors, nurses, and other health workers in the regular hospitals. And that is the weakest link in this treatment of COVID-19 infection in Nigeria. The PPE needs to go round to all the accident and emergency centers and outside ward that have direct interaction with all patients in this country. Otherwise, we'll continue to put our health workers in that perpetual danger of contracting these diseases. As you are aware, some doctors and nurses in UBTH as well as in UITH had contact with those who are positive without them knowing. And again, there are some that they will come, you have that index of suspicion, but if you have not done that test to confirm their status, it may be difficult for you to ask them to go into isolation. So what is expected is for us to have this PPE all over all hospitals, either private or public, so that when doctors and other health workers are having interaction, first-time interaction with patients, they are properly prepared and well fortified. Unfortunately, we have not been able.
All right. Dr. Fadule, sorry, it appears we've lost you again, but we do hope that you are able to come back on in the course of the remainder of the time that we have. Let's see if we can pick up Dr. Vivian Kwage again, Head of Infectious Disease Unit at University of Abuja Teaching Hospital. Dr. Vivian, if you're right there, fine. Now, I mean, there is an appreciation, as it were, of the hazards that healthcare workers face today in our various hospitals, whether or not it's infectious disease or our regular hospital cleaners and all. But using your own personal experience, tell us, what is your routine at close of work and when you are returning to your family? What do you do? How do you decontaminate yourself?
Thank you very much. I want to show here that it is not proper for doctors working in the isolation unit, doctors managing COVID-19 cases to go back to their families at the close of day because they pose a very high risk to their family members. For us here at the University of Abuja Teaching Hospital, when we started having cases of COVID-19, we discussed with our management and we explained to management the heightened risk that we pose to our family members. Some of us have our parents, our aged parents living with us, and we all know that COVID-19 is severe among the elderly. So we discussed with management to get an alternative accommodation for all the staff working at the isolation unit. And that was what management did. They went into agreement with a nearby hotel that offered us accommodation. And for the past 2 weeks, 3 weeks, we have been operating from that hotel. I have not gone to see my family for the past 2.5 weeks. So that is one of the measures we have used to reduce the risk to our family members, not to go home at the end of the day. But by and large, after examining any patient, as you come out of the isolation unit, we decontaminate ourselves with chlorine water. Okay, we have a staff that stands by to decontaminate us with chlorine water. Of course, we know that we put on the PPE, the personal protective equipment, the gown, the goggles, the face masks, the shield, the face shield, before we even go in to attend to these patients. So that again is part of the or one of the measures we take to reduce the risk. So when we come out of the isolation ward, we doff, that is, we remove the PPE in a systematic fashion so that we don't contaminate ourselves, because we have instances where healthcare workers have been contaminated by the PPE that they wore. In the process of removing the PPE, if you don't remove it well, you end up even infecting yourself. So there is a systematic way, we call it doffing, systematic way of removing the PPE. So after removing the PPE, we again decontaminate ourselves with chlorine water. And then we don't go home to interact with our family members. And even the staff working in the isolation unit, they have been relieved of their duties at their primary site of, their primary places of work. The nurses have been relieved of their duties at their post, the doctor, so we don't go back to manage other patients in hospital. That again is another measure that we have taken, to avoid, putting other healthcare workers at risk. So we don't interact with the other members of staff, So by and large, those are some of the things we have put in place to contain, the infection, not to be a source of, infection to the other people in the society.
This is a brilliant idea, Kingsley. The measures are on point based on what you have explained to us now. And of course, you can see other sacrifices they are making, not just the issue of being on the front line, they also sacrifice their family, normal family interactions and all of that. We appreciate that.
That's from University of Abuja Teaching Hospital. I think it will be helpful, at other isolation centers
to be doing the same.
Yes, assuming that they are not already on the same page, for them to take a hint from what is being practiced.
Of course, I think that should be kind of coordination, between the centers operating in Nigeria at the moment. And let's return to Dr. Chris Otabo. Dr. Chris Otabo, Dr. Francis Adebayo Fadil raised a very critical point here. He said that those who have symptoms of COVID-19 usually go to regular hospitals, without feeling that he or she may have it. And again, the medical personnel in such hospitals wouldn't know as well, and they're not properly protected, and then they will normally attend to them. This is another way of perhaps spreading this disease. based on what he said. Now, how can such situation be tackled? Or what could be done for other health givers in different parts of the country, key into the COVID-19 situation and know what they could do differently?
Thank you very much. I just can't continue without appreciating Dr. Kwari and the other healthcare givers who are battling to save the situation. Thank you very much for what you are doing. For me, the biggest threat that COVID-19 poses is not even the symptomatic people who come to the hospital, but the asymptomatic ones, those who are infected but yet they don't have symptoms. Those ones who come to the hospitals to do appendectomy, they will come to the hospital, haven't had injuries, and they will present to the hospital. And the fact that they are not having symptoms does not stop them from infecting others. And so, whether they have symptoms or they don't have symptoms, what is important is that we take a universal precaution, assuming everybody to be positive. That's the best thing to do. For the ones who come with symptoms, there's supposed to be a protocol. There are a combination of symptoms that heighten your suspicion. And for those people, in fact, from the gate, there's supposed to be a temperature check. If the temperature is high, they don't come into the normal place. There should be an isolation area in the hospital where they are attended to. And because now they've given the sign, you follow suit and make sure that you don't mix them up. Okay? But for those who are asymptomatic, they have been exposed, they have been infected. Don't forget, about 80% of people would not show anything serious. Most of them will just be fine. But yet they can infect others. So because of that possibility, every doctor working in Nigeria now, especially in the cities where COVID has been diagnosed, must assume every single patient to be positive and therefore take the necessary precautions. So you don't touch patients directly. If not necessary, you don't have to examine. Consultation, e-consultation should be encouraged now. All the elective cases should be shoved aside. Hospitals should just manage emergencies. I mean, someone who has had a fracture for 6 months and is coming, says he wants to fix his fracture, it's not necessary now. Push it until after the COVID is over. If there are things that can be pushed, push them. Just take care of the emergencies and take care of them as though you are dealing with an infected patient. If we do that, we'll be able to curtail the spread. But the problem is the finances. We lack, most hospitals lack the personal protective equipment. Many doctors have not even seen it. And yet, they are in the front line, they will be treating patients.
Okay, Dr. Tabo, thank you very much. I want to bring in again Dr. Dorfa. I remember sometime last year on Good Morning Nigeria, we had you, and then you were talking about a new protective gear that's supposed to something like coated with Teflon, on which pathogens cannot stick. But in the context of COVID-19, here we are. One, there is a presumption of a global scarcity of PPEs at the moment. And you listen, of course, you are in the same field. Our viewers heard Dr. Vivian talk about how medical personnel have to doff themselves, carefully take off, their PPEs. I've also watched and seen some persons say, particularly in the advanced world, that those PPEs are supposed to be disposable. Once you come out of an operation, or so, you are supposed to dispose of it straight away. Now, these things are scarce and they're also expensive. How do we cope in our environment?
The PPE as such for medical personnel who would be encountering patients with infection, there is the medical personal protection, not equipment, but apparel, which has three major components. It repels fluid, it's antimicrobial, and you can breathe in normally because it allows sweat to escape. That apparel has not been utilized at all It will fix very well the missing gap between the established case in the ICU with personal PPE, which you cannot use in the OPD. Children will come and see, once they see you, they'll run away, however ill they are, when you put that gear. But there is this Vertex, which we demonstrated some weeks ago, which can comfortably fit in, which is open for all other health workers to inspect, and we have it in stock, which I'm not advertising, but it's a good thing for this season. And for another reason, for other seasons, of a case of Lassa fever and any Ebola. It was brought in purposely to enable you wear it, feel normal as a health personnel. We have it in scrub, lab coat, and once you have that lab coat, at least you are protected from any discharges from the patient. And it's the same, at the same rate, we have face mask, which is made of the same material. And that face mask at least covers you for any eventuality, which I'm sure we can. This face mask is made of the same material as the Vertex. So it can give a lot of protection to normal health workers.
Okay, now this is locally made. This is locally made.
It's locally made.
Okay, we'll stop here. We're running out of time. We would like to return to Shetima Ambeth Thomas, Secretary General, National Association of Nigerian Nurses and Midwives. You have listened to other guests discuss this issue from different perspectives. You are the National Secretary of the key people on the front line, that is the nurses. And of course, I'm sure you've had the explanation given by Dr. Vivian in how they have adopted some measures to see how they can, carry out their responsibility without so much exposing themselves. Going forward, what are your thoughts of what should be done for these your colleagues who are now being confronted head-on by coronavirus?
Your colleagues who are now being confronted head-on by coronavirus.
Well, we are still experiencing a difficulty getting through to Shetima. We are sorry about that. Time is no longer on our side as to see whether we can bring him back on track. But now it's not practically possible based on time. And let's ask David to come up with his own final thoughts.
I just wanted Dr. Faduile. Faduile is the president of the NMA. He was honored, and suddenly we had a swoosh that popped off. Dr. Faduile, very, very briefly, yes, I mean, in a sense, we've explored some of the very key points on this subject matter, but it's a running story, as it were. What is the state of insurance for healthcare workers in Nigeria? Is it something that the insurance industry can look into right now? Because let's face it, I mean, the government cannot insure all doctors. I mean, some are private, some are public medical doctors. So what is the state of insurance for healthcare workers, and what would you like to see?
Well, thank you very much. I think it is important for us to state that every health worker who is in the front line ought to be well insured. And we have seen in many countries, even African countries, where those health workers have been given a comprehensive insurance package that has been able to motivate them. I'm happy the infectious disease physician from the Abuja Center has told us how far and what they needed to do. Up till 7th week, we're in the 7th week of COVID-19 pandemic or epidemic in Nigeria. Up till now, we have not had an insurance package that our federal government or the different state governments have put forth towards people who are working at the frontline area. And I must say at this point that it is every health worker, though those at the isolation centers may have higher risk, but every health worker, wherever they are, is at that risk of contracting COVID-19, because patients who come to the hospital are not only patients that are negative. That is the general hospitals. So we must have comprehensive insurance for all health workers. As it is, we have decided on part of NMA not to bring forth the issue of money, but it might stress you that all doctors and other health workers in this country collect 5,000 naira monthly as hazard allowance.
All right, Dr. Francis Adebayo Fadule, President of the Nigerian Medical Association, NMA, we thank you. We didn't cut it short, but time is not on our side. Thank you indeed for your contribution today on Good Morning Nigeria. I would also like to appreciate all those that reached us via Skype. And Shetima Ahmed Thomas, Secretary General of the National Association of Nigeria Nurses and Midwives, also thank you and appreciate your time and your insight as well. Dr. Vivian Kwahe, Head Infectious Disease Unit, University of Abuja Teaching Hospital, Gwagwalada. We thank you also for the good job you're doing and of course making yourself available this morning for us to interact with you. Thanks to all of you for being part of our show this morning. Now back to Abuja. Let's ask Dr. Isaac Abuja to just within 20 seconds, your closing remarks.
Well, I would want to again close by thanking our staff, health workers who are putting their lives at risk, and also to request the government and all hospital authorities that are the employers of those whose lives are at risk to think about insuring those who are sacrificing and risking their lives on a daily basis, and for them also to think of the monies that they are receiving to be channeled into training and retraining of health workers. These are not things that you do overnight. Now that we have time, there's a window of opportunity. We should be training more people on how to do many things, especially for those hospitals that are receiving patients in an unsuspecting manner. We have to get them trained.
Okay, Dr. Abuja, thank you very much. As I said, we're having to wrap all of this up very quickly. In addition to the donations that you are saying should be used for training, part of the donations could also be used for the payment of premium for the insurance in this emergency, assuming the governments, states and federal, do not have enough monies laid out for this particular purpose. Dr. Chris Otabo, thank you very much for being with us on Good Morning Nigeria. And Dr. Abuja, always a delight having you. And the pioneer CMD of University of Abuja Teaching Hospital, Dr. Nandul Dofa, thank you for being with us on Good Morning Nigeria. We also would like to thank all those who sent in their tweets, our regulars, Elijah Ngala, Dele Jack Solomon, Titus Mondenok, Mike Ayanko, Amagbola Babs, Adejumo Paul, Bashiru, Sandy Michael Amakoji, Olakunle Sharon, and several others. Thank you for being with us. Good Morning Nigeria returns on Monday, same time, 7 o'clock in the morning. Until then, don't stay safe, because health is wealth. I'm Kingsley Osadolo.
And I am Kirian Umayo. Happy Easter to you all.